Hi, I'm Jane McCallion.
And I'm Adam Shepherd.
And you're listening to the ITPro Podcast, where today we're talking about the role of IT in healthcare.
Despite sometimes getting a bad rap when it comes to technology, healthcare is a more technologically driven sector than many recognise. Hospitals are filled with specialist machines and computers appeared in doctors' offices well before they were common in many workplaces.
As technologies like cloud and strategies like digital transformation have taken hold across all sectors, hospitals and healthcare services across the country have moved to embrace them to help improve the experience of both patients and clinicians.
Joining us today to talk about his experiences in this area is Craig York, CTO of Milton Keynes University Hospital's NHS Foundation Trust. Craig, welcome.
Thanks very much.
So Craig, first of all, could you tell us a little bit about your background and your role at MKUH?
So as you've already said, I'm the CTO at Milton Keynes Hospital. I'm a bit of a lifer in the organisation and the NHS. I joined the NHS in 2000 in the Milton Keynes what was Community Trust, which transformed into a PCT. A couple of years later, I moved over to the hospital as a developer, which moved into the management of the development department or team. A few years there, moved over to infrastructure management, and then into the management of larger teams, head of IT, and then moved into more of this role, which encompasses our whole IT department, what was our GD fast follower program, and our EPR program as well.
Is there such a thing as a typical day for you? And if so, what does it look like?
One of the things I like about my job is it's always different, ever changing. It could be just going through emails and responding to the things that might have been escalated to me. Business case development, strategy. It could be general managers or associate director of operations that need to talk about some of their service development. So no, not really. It's very different every day. It's one of the reasons I really do enjoy my job.
So with one of the common things pretty much across all organisations is that the pandemic has forced virtually every organisation to accelerate digital transformation efforts. What was your situation and plans before the pandemic hit, though?
Before the COVID pandemic hit, we were in the throes of about to go live with a significant or several significant new modules of our EPR. Our go live was due in April. We had a large program team here. There was significant transformation about to happen in the organisation, and it was a cause of great stress and strain about exactly when we paused that with both our internal teams, both in IT, across the organisation, and with our supplier, which of course we did. There was no option. We couldn't go into that kind of transformation when the pandemic was affecting the world so much and our organisation as much as anybody else's.
And EPR, of course, being electronic patient records. For those not in the healthcare IT sphere, what does that kind of transformation entail?
In the hospital, our electronic patient record is our biggest system. It's the investment that we've made, tens of millions of pounds over a decade or so, and wow. It's the system that manages your patient records when somebody comes into the hospital. That starts with an initial admission, and then transferring them across the organisation. We will use it to order blood tests, other diagnostics, imaging. Those other connected systems will return that information into our EPR, alert clinicians to that. It's the management of those patients through to their discharge as well.
It sounds sort of like a specialised and particularly comprehensive customer relationship management, CRM type system.
Yeah, very specialised to healthcare, very complicated, and it's ever changing as technology moves on. Very much at the moment, one of the things as I look out on the team that have come in today, that need to come in just because of COVID, they're working on connectivity of ECG machines. So we already have rolled out new ECG machines in the organisation, and what we'll be doing is electronic ordering of those ECGs, and so this is the trace, the kind of graph that you might have seen on a long piece of paper in the past, and that may have been scanned into what we call our legacy medical record system now. We did that 10 years ago. What we'll be doing very, very soon is having that trace electronically go into our EPR as a digital form that people can read as part of a comprehensive EPR record.
So this EPR modernization project, obviously a very key project for the hospital's IT. How soon do you anticipate being able to restart this project?
Yep. So we're already live with significant portions of it. What we were doing was going live with some further modules, in particular pediatrics, some theatres functionality, so we're just in discussion. We're about to finalise that now, but it will be there'll be 2 go lives next year. So unfortunately, there's a good 18 months delay that COVID has on our project here.
Other than kind of putting the brakes on this particular project to what sounds like a great extent, what other effects have there been of the pandemic on your particular department?
Yeah, so quite a sensitive subject. So I'm a little bit conscious of the fact of saying that good things have come out of this as well. It's often said that technology has made great strides over COVID, and it is true.
Well, I saw somebody, it was in a feature that we published earlier this week as we're recording, and they described it with the whole necessity is the mother of invention, and we're kind of quite fortunate in some ways generally, kind of as a country as a whole, let alone in the field of medicine, that some of the technologies that were there, such as cloud-based collaboration platforms, that kind of thing, just even portable hardware, this laptop that I've got in front of me, have all been available at the point that this happened. Whereas if it happened in, say, the 1970s or even the 80s, this would have been, even more of an economic crisis and business crisis than it has been.
Yeah, so we were in a really good situation in terms of a technology platform at the time of COVID, when staff were sent home where they could. We already had good network bandwidth into the organisation. Those staff that had their own corporate devices could simply go home, turn the VPN on, and carry on. Our productivity suite, we'd migrated completely over to Office 365 already. So those collaboration tools of Teams were already somewhat familiar to a number of staff, and those that hadn't made the jump to spend some time there, they quickly got up to speed. For those staff that didn't have corporate devices, within a few days we had we put some Azure virtual Windows devices, made those available to them, and we built out on an app that we'd already built, so all our staff could just go to a website. We made it very easy. We put a corporate branding on it. Go to this website, log in with your AD username and password. There are a number of applications that are there at the click of a button, and if you need more, just click on the one that said desktop, and they would launch a virtual desktop in Azure and had access to 99% of the things that they would have, just as though they were in the hospital. It took a little while. The NHS uses a national smart card, for access to some of those national systems. So it did take us a couple of weeks to get that working on all the devices we wanted, trying to accommodate, in my corporate office, we just roll out Windows. But that may not be the case of staff at home. They may use other operating systems, and trying to accommodate everybody's needs was a bit of a challenge to start with, and took a few weeks to overcome all of those.
So we've spoken already about some of the systems within the hospital and some of the projects that you've got on the go at the moment. But aside from COVID and its various effects, what are your main priorities in terms of the hospital's IT and its infrastructure?
So we've got a reasonably mature digital level already. I think it would be fair to say that our biggest goal is to really focus on the patient and well, as a person these days, person-centered care, and making them a fully engaged stakeholder, and them having the data on their devices, or achievable on any device that they want as well.
Mm. And you've recently started a partnership with Apple in this regard, right?
Yeah, so we are one of two hospitals in the UK to work with Apple, and our patients can have access to their records via that Apple Health app. So that means that they can connect their iPhone to our patient records in the hospital, and whenever there's an update, that will get pushed down to their iPhone.
I've got to say that, I do find this quite exciting, actually. When I first read about it, I think that for anyone who is in regular contact with the hospital, it's got to be great to be able to access the records that the hospital has about you, because obviously it's fairly critical and personal and potentially kind of emotional stuff that you might want to be able to read up on yourself.
Yeah, quite selfishly, my dad has had cancer in the past, and he now regularly has blood tests via the GP, so primary care, but those lab works go through our hospital, and he knows that he's got to be conscious and about the levels of these results, and he sometimes forgets what when the last reading was. So does he need a new test? Does he need to contact the GP? Or if he has done and he's been to the GP, he's sometimes waiting for a week or two for the result. Does he need to constantly phone the GP? Have they got it? Have they forgotten to phone him? And now he's in the case of the first time he logged onto that, he could see the last result that he wasn't aware of, and it had come down slightly. Immediately he was relieved. And the next time that he got he had a look at it, it was actually a push alert to him. And that happened at the same time that the GP got the result. So the GP was electronic sent result, and that was made available to the patient, my father, at the same time. It pinged on his phone, he opened it up, and immediately he knows that he doesn't need to worry. And I know that there's sometimes there's an argument that patients should be given the results by a clinician, a professional, just in case there's some concern. But having listened to not only my dad, but many other patient advocates over the years, they all say that actually it's their data. They want it in a timely fashion, and in a lot of the cases they understand it. And bad news is bad news, whether a clinician may give it to them or they're receiving it themselves with someone else.
We're going to take a short break now, but when we come back, we'll be talking about some of the hospital's other projects and what learnings they can take forward from them into 2021 and beyond.
See you after the break.
Welcome back. Now, Craig, Before the break, you were telling us a little bit about some of the work you've been doing with Microsoft around Office 365 and some of their cloud tools. But can you share a little bit more about some of the work you've been doing with Microsoft and with Azure?
Yep. So we've been working with Microsoft for a long time. We were early adopters to move over to Windows 10, and that it really helped us in terms of our roadmap into Office 365. It gave us a good platform to jump into that. And when the national agreement with the NHS came along, which is that the government effectively paid for licenses for Windows 10, we were able to then move what was our ongoing investment of our Windows desktop over to Office 365 with Microsoft's help. We did that, and for us it was a relatively straightforward migration of on-premise, reasonably high-level Exchange over to Office 365. The thing that took us quite a long time was to migrate people away from old file shares, SMB file shares, and move what they thought of as their home drives over to OneDrive, and department file shares over to Teams. We did have very good engagement from the departments, and which helped things along, but some of those, especially some of the corporate departments, there was a lot of data to move, and it took a good probably a year from start to finish in terms of Office 365, Teams, SharePoint, and migrating over all of those file shares, which was quite significant. Alongside that, we matured our Windows platform as well, making use of ATP, which then moved into one of the things that the NHS has done via NHS Digital is a deal with what came as a prerequisite, a requirement for organizations, if they took the free licenses from NHS Digital and Microsoft, was the requirement to point your ATP platform up into a tenant where NHS Digital could have a window into what was going on. And this came all on the back of WannaCry, and I think everybody's understanding that the next WannaCry is just around the corner. Is that a few weeks, a few months, a few years, it will happen again. And the next time it does, the NHS as a single organisation needs a view of what's happening across the 1.3 or so million devices that it has. So that was important. I think cybersecurity and our use of things like Windows 10, ATP, and the other tools that we use in our cybersecurity team has been really key to our transformation as an organisation.
Do you feel like the NHS as a whole is better protected from things like WannaCry now than it was back in 2017? Yes
and no. Yeah. Yes, in terms, it was fantastic that we got a deal as an NHS organisation. Everybody is moving over to Windows 10, but not everyone's done it yet, and we receive regularly, every organisation in the NHS receives regularly a report on who's got what devices, what versions, and there is still a significant amount of devices out there that are Windows 7 or below. And that needs to be quickly resolved. It's tough, it's hard, because it takes years to move up versions and to have the technical ability within your organization to do that and to manage it. And that's why we worked early on with Microsoft. We asked them for help. They came in, they sent partners in, they helped us build a nice, secure, tested, version of Windows 10, and we were able to roll that out reasonably quickly. I say reasonably quickly; it still took years. We have a 4-year replacement cycle in our organisation, which means we have capital investment every year to replace a quarter of our estate. And if we did, and that's what we used to do, and if we did that, it takes 4 years to replace an operating system. I think we did it in about just under 3.
Wow.
But if you're starting now or haven't finished now, and have still got a few thousand desktops out there across your organisation, you're not in great shape. And on your site and others, every week I'm reading about another healthcare organisation around the world. It might not be the UK, it might be around the world, that has had some kind of cyber attack. And it's probably one of my greatest fears, the next attack on the NHS as a whole. And it's something that we look at all the time. Today or every week we have our an IT management meeting, and our cybersecurity manager brings there a dashboard of all the things that's happening. What do we need to focus on this week? What are the messages that we need to go out to our all of our staff? How are we further protecting them, etc., etc.
And I think that's one of the things that frequently gets overlooked in terms of the NHS cybersecurity response, is how much effort goes into managing the rollout. It's not as simple as just flipping a switch and upgrading everything to Windows 10. There's a huge amount of training that goes into it for clinicians and for IT staff, for ensuring compatibility with all of the various systems and pieces of equipment that these devices need to work with. It's a completely different beast to, say, for example, a corporate rollout.
Yeah, and we have literally dozens and dozens and dozens of clinical systems, and some of those don't like Windows 10, don't like 64-bit operating systems. You might need to make compromises or run them in a different way, or at the very end we might need to reprocure a system or migrate to another one that is capable of doing that. But that takes significant amounts of time. And while I've said that we're lucky in terms of our investment that our organisation provides us in terms of replacing devices on desktops, other organisations, they have some aging equipment, and it's they might not be able to actually physically deploy Windows 10 to them, and they have to plan out that capital investment first before that they can deploy that operating system.
Yeah, and I'm sure that most of our listeners, this idea of compatibility and legacy hardware or software, while they may not be dealing with specialised medical hardware or software, it's a common experience, I think, for many organisations, and that quite often, if there is an older OS, it's not so much laziness or what has been perceived as laziness. It's there's a reason for it typically.
I think the good thing now is, though, that now that Microsoft have moved to this more very modular Windows 10, it's smaller modular upgrades that we're always pushing out now. I'm hopeful for the future that once organisations get to Windows 10 like us, that upgrades over the next years to come, decades to come, will be a lot easier.
I mean, in theory, the whole promise of Windows 10 was that this was the last major OS upgrade that anyone would need to make again, and that it would all just be rolling updates from here on out, which, in fairness, so far they seem to have mostly delivered on.
So I was probably sceptical, as perhaps you may be as well, but so far it's working. And the idea of updates coming down for Windows that provide the latest operating system with Office 365 and those other kind of cloud-friendly offerings of software, actually, it's a different mindset than 5 years ago, where it was you might need to visit a PC, or those old kind of maybe SECCM deployments that you had to keep being on top of. some of those problems are starting to disappear for us.
So, Greg, what lessons have you learned from all these experiences, over the course of the past 10 years or so, COVID, non-COVID, dealing with ransomware attacks, all of that? And which of these do you think would be applicable outside of healthcare?
So our one of our vendors has one of their mantras is get current and stay current, and I like to steal that and then embed that within our own organisation as well. And I think that staying ahead of the curve has been incredibly important to myself, my department, and the services that we deliver to the organisation and outside of that as well. And it enabled us to provide a good service, one during COVID, and one that our staff themselves were then able to carry on and work. And I think it was incredibly important. And over COVID, it highlighted things, but day to day, it's important as well.
And I think that's something that many people might find slightly surprising, because I think, as we alluded to at the start of the episode, many people seem to have this image of public sector IT as being a little bit lagging behind the private sector at times in terms of its adoption of new technologies and the speed with which it rolls them out. But I mean, based on your kind of experience in MKUH's roadmap and the speed with which it's rolled out, things like Windows 10, things like Azure tools, various cloud capabilities, that's really not necessarily the case.
And that comes down to a little bit about risk appetite as well, I guess. And, my risk appetite and the risk appetite of our board, perhaps even our CEO in particular, is one of an acceptance of failure in certain circumstances. And that hasn't always been the case here, but when you know that you can try new things, innovate, and failure is acceptable, it comes down to fail, but fail fast and move on to the next thing. And if your organisation has an appetite like that, it allows us to move forward really, really quite quickly. And I think that's shown in the service that we provide to our staff and patients.
Well, unfortunately, we're going to have to leave it there this week, but thank you once again to Craig York, CTO of MKUH NHS Foundation Trust, for joining us.
Thank you for having me.
And thanks to you for listening.
Craig is also a member of the ITPro panel. His feature on cloud infrastructure is linked in the show notes, where you can also find more information on all of the topics we've spoken about today.
Don't forget to subscribe to the ITPro podcast wherever you listen, and you can also follow us on Twitter, where we're at ITPro, as well as Facebook and LinkedIn.
We'll be back next week with more analysis and insight from the world of IT, but until then, goodbye.
Bye.
The ITPro Podcast is brought to you by the Dennis Podcast Network.